I would continue with the previous part of this National Health Policy 2017. This again came after 14 years of gap with the context of providing health, bringing about certain health changes in many ways, and the growing number of non-communicable diseases, infectious diseases, the rise of private sector, increased expenditure on health, and rising economic growth, enabling enhanced fiscal capacity, have shaped the 2017 policy. And this policy aims at providing health care in an assured manner to all. And in fact, there had been a shift from sick care to wellness and well-being of individuals. So it particularly focused more on the well-being and wellness part of an individual. And in fact, Ayush had been given special emphasis in this health policy. And there were certain important priority set for improving the health condition of the country, which was like Swachh Bharat Abhiyan, the balanced healthy diet and regular exercises, addressing tobacco, alcohol and substance abuse, Yatri Suraksha, preventing deaths due to rail and road traffic accidents, Nirbhay Nari, reduce stress and improve safety in the workplace, and reducing indoor and outdoor air pollution. These were the major key points, priority areas where health policies should be moving in the direction. The health policy, however, launched in 2017 by the central government to replace the existing health policies, and this had four significant goals: changing the health priorities, that is to tackle increasing non-communicable infectious diseases in India. Secondly, growth of the health sector care industries, since one of the important agenda of health policy was from sick care to wellness and well-being. So it wanted to talk about, or rather it planned to strengthen the healthcare industry by introducing newer and more advanced technologies. It also is also focused on lowering the expenditure to reduce medical expenses and other healthcare and health related costs, which aimed at providing superior services to the more marginalized and backward communities, even the poor and poor. So it was to access them, to equip to equip the marginalized and poor people with better with a healthcare system at low cost. And then it also aims at enhance the fiscal capacity by boosting economic growth. The key features of this policy of National Health Policy of 2017 was to provide superior healthcare services to all age groups and genders, to ensure universal high quality healthcare services and affordable cost, a healthcare oriented approach in all developmental policies. The goal is to lower the number of people who die too soon from cancer, heart diseases, breathing problems and diabetes by 25% before 2025, to recognize the importance of sustainable development and setting time bound quantitative goals. And the goal was also to improve healthcare in all aspects, including services that would help people stay healthy, feel better when sick and recover from illness. There are certain principles of the national health policies. Professionalism, the first principle is nationalism, professionalism, integrity and ethics. The healthcare professionals should maintain high standards of professionalism, integrity and ethics, and this should be supported by a strong regulatory environment. Second principle was equity. We should strive to reduce inequality in healthcare. This means reaching the poorest people and minimizing disparities. The third principle was affordability, that is to make healthcare more affordable. This means preventive catastrophic household healthcare expenditures, and these are defined as health expenditures exceeding 10% of a household's total monthly consumption expenditure, or 40% of its monthly non-food consumption expenditure. Then universality, everyone should have access to healthcare, and this is regardless of their social or economic status or health or current health status. Then patient centeredness and quality of care. Healthcare services should be gender sensitive, effective, safe and convenient. They should be provided with dignity and confidentiality. The next principle was accountability. Healthcare system should be financially and performance accountable. There should be transparency in decision making, and corruption should be eliminated. Then next was inclusive partnership. It should talk about the multi-stakeholder approach to healthcare. People should invest and should contribute in the healthcare system. So the multi-stakeholder concept was introduced with this health policy. Then pluralism, inclusive partnership had just been taken into consideration. So pluralism, patients should have access to Ayush care providers if they choose to Ayush. If they choose to, Ayush is a system of traditional Indian medicine, and it should be based on documented and validated local home and community based practices. Then decentralization, decision making should be decentralized to the lowest practice level, and it should be to promote community participation in health planning process. And then we have dynamism and adaptiveness, that it should constantly improve healthcare system based on new knowledge and evidence, and it should also learn from the communities and from national and international knowledge partners. Then the objectives of national health policy in 2017 was, first of all, it aims to offer superior health services to every age group and gender based on the principles. These objectives were framed, and the objectives particularly focus on revamping the entire health policies of the previous years, that is of 1983 and 2002, with the primary focus to have accessibility to better healthcare opportunities, healthcare services to each and every individual, irrespective of the caste, creed, and gender. And this policy it also aimed at ensuring quality health services to all. So the policy focuses on providing universal accessibility to excellent quality healthcare at a very reasonable cost. It had also looked into the point of curbing the expenditure which is involved in healthcare services or availing the healthcare facilities. Then promoting healthcare orientation in every developmental policy, offering accessibility to better treatment, lowering expenses related to healthcare services, and improving the quality of service. It also aims at premature mortality from cancer, cardiovascular diseases, chronic respiratory diseases, and diabetes by 25% within 2025. Then the policy also recognizes the importance of sustainable development and time-bound quantitative goals. And the then national health policy in India tried or rather focuses to improve the overall health status through promotive, palliative, and rehabilitative services. Now, there had been a lot of health programs and health initiatives during these 50 years, and in fact, a lot of initiatives had been taken in the previous as well as in the current situation. So, if you talk about the health programs, and schemes which were made available under the umbrella under the reproductive, maternal, neonatal, child, and adolescent health were as follows: the Janani Suraksha Yojana कार्यक्रम, राष्ट्रीय किशोर स्वास्थ्य कार्यक्रम, राष्ट्रीय बल स्वास्थ्य कार्यक्रम, मिशन इंद्रधनुष, जननी सुरक्षा योजना, प्रधानमंत्री सुरक्षित मातृत्व अभियान, and the Navjat Shishu Suraksha, a national program for family planning. Then under the National Nutrition Program, a National Iodine Deficiency Disorders Control Program, then Mothers with Absolute Affection Program for infant and young children feeding, young child feeding, then National Program for Prevention and Control of Fluorosis, National Iron Plus Initiative for Anemia Control, National Vitamin A Prophylaxis program, then integrated child development services, and midday meal program. Under the communicable diseases, these were the program initiated and these were as follows: the integrated disease surveillance program, revised national tuberculosis control program, national leprosy eradication program, national vector-borne diseases control program, national AIDS control program, pulse polio program, national viral hepatitis control program, national rabies control program, and national program on the containment of antimicrobial resistance. Then under the non-communicable diseases, these were the certain programs which had been initiated by the government and which almost had been applicable to almost all the states. That is the National Tobacco Control Program, a National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke, a National Program for Control Treatment of Occupational Diseases, a National Program for Prevention and Control of Deafness, mental health programs, national mental health programs were initiated, the National Program for Control of Blindness and Visual Impairment, Pradhan Mantri National Dialysis Program, National Program for the Healthcare for the Elderly, for the healthcare of the elderly, and the National Program for Prevention and Management of Burn Injuries. Then health system strengthening programs are also being initiated like Ayushman Bharat Yojana, Pradhan Mantri Swasth Suraksha Yojana, a Lakshya Program, Labour Room Quality Improvement Initiative that was, and the National Health Mission. Then there were certain important legislations which were related to health and which had been in the form of act and amendments and legislations in order to look after and to provide the safety and security net to the population. The Indian Medical Council Act of 1956 and Regulations 2002, the Indian Nursing Council Act of 1944, the Dentist Act 1948, the Pharmacy Act 1948, the Rehabilitation Council of India Act 1992, the Indian Medicine Central Council Act 1970, and the Homeopathy Central Council Act 1973, and the Clinical Establishment Act of 2010 are the related to quality of education and training of health personnel. Then there's a Registration of Birth and Deaths Act 1969, Spread of Epidemic Act, Diseases Act 1994, the Cigarettes and Other Tobacco Products Prohibition of Trade, Commerce, Production, Supply and Distribution Act 2003, the Mental Health Act 1987, the Narcotic Drugs and Psychotropic Substance Act 1985, the Drugs and Cosmetics Act 1940, the Prevention of Food Alteration Act 1954, Persons with Disability Equal Opportunity Protection of Rights and Full Participation Act of 1995. Then various women health related acts were also being initiated like that, like the Maternity Benefit Act of 1961, Family Court Act 1984, the Dowry Prohibition Act 1961, and Immoral Traffic Prevention Act 1956. To protect the children and their rights are the Parental Diagnostic Techniques Regulation and Prevention of Misuse Act 1994, the Infant Milk Substitute Feeding Bottles and Infant Food Regulation of Production, Supply and Distribution Act 1992, the Juvenile Justice Act of 1986, the Child Labour Prohibition and Regulation Act 1986, and the Child Marriage Restraint Act 1992. For the protection of workers and their families, a number of acts has also been passed and legislated, and these include the Minimum Wages Act 1948, the Dangerous Machine Regulation Act 1983, the Plantation Labour Act 1951, the Factories Act 1948, the Mines Act 1952, the Employees State Insurance Act of 1948, the Workmen's Compensation Act 1923, the Bonded Labour System Abolition Act, the Trade Union Act of 1926, the Dock Workers Safety, Health and Welfare Act 1986, Mines Labour Welfare Fund Act 1972, the BD Workers Welfare Fund Act the 1972, the Cigar Workers Condition of Employment Act 1966, and the Central and the Contract Law Regulations and Abolition Act of 1970. Then environmental legislations has also been into consideration and are very important to ensure good health and well-being. In this regard, the government has enacted number of such as the Destructive Insect and Pest Act 1914, Wildlife Protection Act 1942, the Atomic Energy Act 1962, the Water Prevention and Control of Pollution Act 1974, the Air Prevention and Control of Pollution Act 1981, and the Environmental Protection Act 1986, the Motor Vehicles Act 1988. Then Government of India has also initiated and has made provisions for voluntary groups to work in social, educational, environmental and health domains through acts such as the Societies Registration Act 1860 and the Red Cross Society Allocation of Property Act 1936. Recently in 2010, the Clinical Establishment Registration and Regulation Act was introduced in 2010, which aims at providing registrations and regulations of clinical establishments in the country with the the view to prescribe the minimum standards of facilities and services for them. In fact, in 2011, pictorial health warnings on cigarettes and other tobacco products have come to effect. Then other than these, many act statutes had come under the jurisdiction of Ministry of Health and Family Welfare, including the Prevention of Food Adulteration Act 1954, then Medical Termination of Pregnancy Act 1971, Preconception and Prenatal Diagnostic Techniques Prohibition of Sex Selection Act 1994, and the Food Safety and Standards Act 2006, and the Clinical Establishment, Registration and Regulation Act of 2010. They had certain international treaties and conventions which has been also ratified by India. There has been a significant role of international treaties and declarations on the course of direction of the health policies of India, notably with the international scenario, which focused on curing the communicable diseases. India too planned accordingly. So later, when the holistic definition of health was released by WHO, the perspectives of health widened, and it can be undoubtedly said that India has aligned itself with the global needs and concerns. Some important landmarks in health sector at the international level are as follows. First, I had mentioned earlier also, but again, there is this Alma Ata Declaration of 1978, and this declaration of Alma Ata was adopted at the International Conference on Primary Healthcare at Kazakhstan in 1978. It is the first international declaration and hence an important landmark. The goal of this declaration was to achieve health for all, particularly through primary health care. Then there was International Conference on Population and Development, Cairo in 1994, and the International Conference on Population and Development was organized by the United Nations to discuss various issues related to population, such as immigration, infant mortality, birth control, family planning, education of women, and protection for women from unsafe abortion services. And the conference called for universal declaration, reduction in IMR, MMR, and child mortality, and access to safe motherhoods for family planning. Then in order to the Millennium Development Goals of 2000, the United Nations declared Millennium Development Goals 2000 to be achieved by 2015, and the 8 national goals under it were adopted by all 191 member states. And these goals: first, to eradicate extreme poverty and hunger; secondly, to achieve universal primary education; thirdly, to promote gender equality and empower women; next goal was to reduce child mortality; then next was to improve maternal health; then next to combat HIV, AIDS, malaria, and other diseases; then to ensure environmental sustainability; and lastly to develop a goal partnership for the development. Then WHO framework for tobacco control was also there. In fact, WHO Geneva Convention in 2003, the World Health Organization Framework Convention on Tobacco Control Treaty was adopted in the 56th World Health Assembly held at Geneva, Switzerland. It was signed by 168 countries, and the treaty called for the protection of present and future generations from the devastating health, social, environmental, and economic consequences of tobacco consumptions and exposure to tobacco smoke. Then Sustainable Development Goals, SDGs. The SDGs are a set of 17 goals which has to be accomplished by 2030, and this SDG, since it is an extension of Millennium Development Goals, Sustainable Development Goals of which with the target to achieve by 2030, it is universal and acceptable to around all continents, around all nations and countries. This covers issues like including poverty, hunger, health, education, global warming, gender equality, sanitation, water sanitation, energy, urbanization, environment, and social justice. Good health and well-being for people is the third goal. States ensure healthy lives and promote well-being for all at all ages, while clean water and sanitation, affordable and clean energy, sustainable cities and communities, climate action, and zero hunger are other important goals related to the health. And then lastly, with the National Convention and Treaties, I would like to conclude that within the wide framework of nested health missions and policies, programs, acts, and statutes lies the overarching objective of providing good health and well-being to all. This diverse challenge posed threat to achieving targets. Nevertheless, there had been continuous concerted efforts and dictated research which are still fall of shortage, but still people, the government, the non-government organizations, the civil society bodies, all are making a concerted effort to achieve the target of SDGs, that is particularly to ensure good health to all, and people should have accessibility to health services. The health sector is wide and demanding and requires a comprehensive, detailed review of all previous committees, reports and recommendations, and in-depth ground reality checks. The role of government needs to be enhanced along with revenue allocation for successful results in health sector. However, there has to be a way forward, in the sense that few more measures has to be taken into consideration while talking about health initiatives and health concern. Firstly, India needs more healthcare workers in rural areas, and working with private companies in the short time might be necessary. Then, but it must ensure that private companies follow the rules and don't misuse public money. And to do this, there is a need to collect accurate healthcare data. And then it is also required to ensure that public institutions provide medicines and tests to everyone, and set deadlines for doing so to lower the cost of healthcare for all people. Uh, that was all about health policies and health initiatives, health programs. During these lectures of mine, I had tried to give you both historical perspective and how health concerns where health initiatives were taken place, starting from the very Bhore committee, particularly the post-independence phase. I had through these lecture series of mine, I had tried to at least give you a very comprehensive analysis of all health measures which has been taken in the country since the post-independence phase, how these policies had shaped, how the various committees, recommendations, suggestions has shaped and paved the way for making more robust system in the healthcare, in delivering health services, and how these policies starting from 1983 and under the five, in starting from 1983 till 2017, how these policies had been implemented, what are the various schemes and welfare measures, like the maternal child health schemes, then the communicable disease, non-communicable diseases, all had been comprehensive in dealing with and providing accessibility to healthcare services. So since there has been a tremendous change in healthcare system, but still a lot has to be done. In fact, apart from the national level health policies and the important agendas highlighted in the 5-year plans, India had also been fortunate to sign certain ratification with international conventions and organizations, starting with the Alma Ata Declaration and till looking into the global goals of sustainable development goals, which has to be achieved by 2030. So this was all about the national health policies, and in the next class, in the next lecture of mine, I will be taking two more policies. First is the housing policies, and secondly is the environmental policies. Thank you, everyone.